Ever noticed a change in your vaginal discharge and wondered if it's something to worry about? You're not alone, and the truth might surprise you. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. So let's talk about vaginal discharge, because it's often misunderstood and unfairly stigmatized. In reality, vaginal discharge is not just normal, it's your body's way of keeping things healthy. Think of it as your very own built-in cleaning system. This discharge carries away dead cells and bacteria, helping to prevent infections and maintain a balanced vaginal environment. Now, what's considered normal? Plenty. Discharge can be clear, milky, thick, or thin. Its appearance changes depending on where you are in your menstrual cycle. For example, around ovulation, many women notice a slippery, egg white-like texture. That's your body's way of saying, hey, I'm fertile right now. It can also be influenced by age, sexual activity, pregnancy, and hormonal fluctuations. I remember a patient, I'll call her Anna, who came in concerned because her discharge had become more noticeable and changed consistency. After walking her through her cycle and recent lifestyle changes, we realized it was a normal hormonal shift. No treatment needed, just knowledge and reassurance. But when should you be concerned? Here's the key. Get to know your personal normal. Once you're familiar with your baseline, you'll be better equipped to spot when something's off. Any of the following signs could suggest an issue: a sudden change in color like yellow, green, or gray, a strong or fishy odor, itching or burning, or a cottage cheese-like texture. These symptoms may point to something like a yeast infection, bacterial vaginosis, or even a sexually transmitted infection. Yeast infections are super common itchy, often with a thick, white discharge. Bacterial vaginosis, on the other hand, usually has a musty or fishy smell with a thinner grayish discharge. Both are treatable, but they require different treatments, so accurate diagnosis is key. And while it's rare, sometimes abnormal discharge can point to more serious issues like cervical polyps or even cancer. That's why it's so important not to ignore persistent changes. Some easy steps to protect yourself. Avoid using scented products near your vagina like soaps, sprays, or douches. They can upset your natural pH balance. Stick to mild, unscented soap and warm water. Choose breathable cotton underwear and avoid wearing anything too tight for long periods of time. And always remember, wipe from front to back. Another tip? Track your discharge along with your cycle. There are several apps that make this easy, and it can be an empowering way to really understand your body. If you're ever in doubt, don't guess, and please, don't rely on random internet tips or old wives' tales. Your health deserves real answers. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this helpful, be sure to like and follow for more doctor-approved info you can trust from UB Health. See you next time.